peripheral. I completely understand. I've talked to a lot of students there. I've realized that neither their seniors are doing such thing, nor they got any information how to do that. Even if you look like, even when Shravan will told you his story, he was really interested, but he was not getting any idea how to do that, because he was also from a peripheral medical college. Then he has took a very difficult route, that he has taken a volunteer of photographer for any conference happening. So he just got to know a day before that there's some research conference happening, but he don't have any entry there. So he just went there. He took an overnight bus, took a call that I don't know what will happen. Went there, started requesting the committee that let me enter the team, and then he got a photographer role there. So at least he was very clear that while doing photography, he will be in the site where research discussion is happening. And then that way he made some network there, talked to people, got some idea how to start. So he because there was no access to help, he has to gone through a very difficult route to figure it out. But now at least you can learn from them, and there are a couple of more mentors on the platform who have already done that. Most of the people I've come across who have done that in their first year, second year, third year are from like Delhi K Central Institutes and all. So for them it's easy, but I truly believe that opportunities should be accessible to everybody. So I think I should stop speaking.
Yes, Shravan has joined. Yeah.
Yes. Perfect.
Hello,
Hi, Shravan.
Shravan.
Hello.
I was talking about that photographer story.
Yeah, I heard.
So you can definitely share your struggles to what you have gone through to like come here, which now looks easy. And you're just getting refined information of somebody who have figured it out over this 2-3 years journey. I will quickly introduce myself, and yeah, let me do that, and then over to you, Janice. You can lead this call. I just wanted to personally pop into this session to see how it goes and say hi to all of you, because till now I haven't get a chance. So I'm Astha. I'm a founder of Salaah Shots, and I am a non-medical. But this non-medical have seen a lot of people in her corporate journey, that how doctors struggle, how creating, good evening, Om, like how even simple thing of access to right information and help is very difficult in the medical community, where like doctors are one of the smartest brain. You all have cleared one of the toughest examination of NEET and get a seat for yourself, but giving you the basic opportunity of right information and exploring things have very difficult for all of you. So just to solve that, we started 2 years back this Salaah Shots, and initially we were focusing only on the interns and post-intern for the competitive examination. But now gradually we are entering into the space of helping even the early student of MBBS, be it your interest in research, be it your interest in prof examination, wherever you need help, you should find the help. That's the simple motto. You will find not your seniors sitting all over India, even the outside India. If somebody have interest in USMLE, you'll find somebody who's already there doing their job, clear the journey, so that at least information should be just available for you on a tab. Okay, so I will be there. I am in the group. If you need any help anytime, just drop me a text. All available for all of you. Janice is one among you. He's a final year student, very enthused student who want to understand how corporates work. So he just get in touch with me that he wants to lead the community, and now just in a journey of 4 months, he's leading this whole community. So Janice, over to you. And Shravan, I think Shravan don't need any introduction. I was really amazed when I come across this kid. And I quickly tell him to please join the platform and start letting people know about your research journey. You're on mute, Shravan. I will mute myself. I know I speak a lot. Sorry, bear with me.
Okay, Sean. So, first of all, let's set up your device. You can start sharing.
Okay, sure. Is it visible?
Yeah, it's visible. Yeah, good.
Am I audible properly?
Yes, you are audible.
Okay.
Okay, so I think we can start now. So good evening, everyone. Myself, Jainish, and I am community associate here at the Salaah Shots. I am final year MBBS student. Hope you are all doing well. So, our topic today's topic of discussion is how to start your own research journey as a medical undergraduate. So, before starting, I want all you to please pay attention to the today's topic as it is important and it will uh, make your foundation strong for the future webinars. Like we are coming up with the webinar series for the research only, right from the scratch till the end. So, before wasting much time, let's start. Our today's topic is taken by Shravan. He is feature. He is going to be become feature doctor. He is ICMR STS 25 scholar, and he is also MUSH STGR scholar, and many more. So I think words are less for his introduction currently. And before starting, one disclaimer that what let's give first 40-45 minutes to the Shravan for to complete his discussion and the presentation. And whatever doubt you have, you can drop in the chat box meanwhile, or at last you can unmute and ask, or at that time also you can drop in the chat box. Okay, so Shravan, over to you.
Thank you so much, Janish, for the intro. But I would like to say one thing that I am just one of you. I am not a very different person. So anyone can be me. So let's start today's seminar. So hello everyone. I welcome you all to for this session. I am Shravan Chakankar, third year MBBS student, and I am today here to guide you about how to start your own research journey. So whenever someone says the word research, like when I heard it the first time, so the picture that comes into our mind is that it is something very complex and difficult that installs a fear in our minds, because this was also something I used to believe. But is it really like that? So that's what we are gonna discover in this session. So first of all, I will tell you like what are we gonna learn in this seminar. So I will give you a brief introduction. So we will see the overview of the whole research process. So that what is research, then who should do research, what are the benefits of it, how to manage it with academics, then again, what is the best time to start, how to start, and what are the challenges and how can we tackle them, and then what resources can be used for that. Okay. So, okay. So moving ahead. So starting with what is actually research. So this complex looking term is actually a very simple thing that is there any audio from the background? Is there any background noise?
No, it's clear. Your voice is clear.
Okay, okay, sure. Okay. So what is actually research? So research is basically we want to discover things that we are not knowing yet. So we just discover the unknown. So will anything that we do to discover something that is unknown be called research? No, it is not like that. So for research, you have to follow a systematic process which is standardized and acceptable all over the world. And when you do that, along with that, you have to just keep in mind one thing, that it should be aimed at a specific topic, and whatever output comes from it should be useful for the community. If you do a research on something which gains you knowledge on something that is not known yet, but if it is not useful, then there's no point in doing that research. So moving ahead, then the second most important point is why research matters. Why should we do research? So there are basically three main aspects of this. So the most important aspect is the first one is the academic aspect. So it definitely doing research boosts your CV. Then the second thing is that understanding of the topic. So whenever you do research on any topic, for example, let's say you are doing research on hypertension. So in order to conduct research on hypertension, you will read literature on hypertension. You will go across books. So you will try to go through as much information as possible to you to better understand the topic. So this also improves your knowledge on the subject than actually anyone else that might be in your peer set. So it also increases your understanding on the topic. Then the third thing is that you get to explore various specialties. Now you might be saying that's how that is possible. So the thing is, let's say I am going to do a research in XYZ branch. So whenever I start my project, so I will go up there for the board work and I will read up literature to that particular branch. So what happens is that I give there is also a term called early clinical exposure in our curriculum. It is the same way. So it gives you more exposure to that branch so that you can know for yourself that if you are interested in that branch or not. Okay. Now the fourth point is that thesis. So you all might be knowing that in your ND when you are doing PG, so you have to all write a thesis, and that you have to present and defend at the end of your PG. That is when you are in the third year as a junior resident. So why ICMR or why NMC introduced research to our UG curriculum? It was for the same point that they are not expecting us to do something some breakthrough invention or something or a discovery or something. It is just expected that as medical undergraduates, we are well versed with the whole process and we are familiar with it. So that when we become doctors, so we can conduct it in a better way without any hassle. So the next point is who should do research? Okay, so if you are any one of the following four, so you should do research. The first one is if you have a passion for research, then you will surely do research. No one can stop you from that. Then the second thing is if you want the exposure to the whole process. Like for some, if I am someone कि मुझे पता नहीं है कि मुझे research ही पता नहीं है, so how would I know that if I like it or not if I don't know something? So for the exposure also you can try once and then you can decide for yourself. Then the third important aspect is the most of the people in India usually do research because they want to give foreign exams like USMLE. In USMLE, actually it is very essential that for whatever branch you are trying to apply in the specialization, that is for the PG, that you have to do some research in that field so that it shows your intent that you are really devoted to that field and you really want to become, for say example, you want to become a neurologist or you want to become a neurosurgeon. So relevant research in that field is required to show your intent towards that. So the next point, that this is the main thing that I want to share with you all. There's a very big myth that you have to be a genius to be a researcher. Only the students who score very well or have very high IQ can be researchers. In reality, there is nothing like that. Actually, research is actually a very long process, as we can say. So the only three things are required for that. The very first is that you need to have passion for that topic that you are pursuing. The second thing is you need to be consistent. It's not like today I will do research and then kal ki nahi, ab man nahi hai, so ab chhod diya. It's not like that. So the second thing that required is dedication, consistency, and the third thing is persistence. So in the process that we can say in the journey of research, बहुत से बार ऐसा होगा कि there may be obstacles in your way and you will be demoralized. But even उसके बावजूद भी you have to keep going. So that's the only way you can reach to the finish. So you don't have to be the genius to be a researcher. You just have to be consistent, dedicated, and persistent. So moving ahead. Okay, so the main question. So अभी हमने ये तो समझ लिया कि research होता क्या है. So now कि आप शुरू कैसे करें? How to start? So the very first thing you should do is you should analyze your field of interest. Which topic you like, which subject you like. So you should start some reading on that subject. Let's say if you are a first year student or if you are a second year student. So you are, for example, you are reading Guyton in physiology and you came across some point and you are like, oh, this is a very interesting thing. And this has not been very well given here. So you go and read up more and then you find there are some gaps here. So you have to first analyze your field of interest. Then the second step is key. After you analyze your field of interest, you select that topic. Then you have to do thorough reading on that topic. You can download some articles from the net. You can read some books, reference books. Then after you have done that, you have to go to a professor in your college and then tell them, sir, ma'am, I am really interested in research and I want to pursue research on this topic. And I have gathered this information on this topic. I have read this. If you go without studying, then they will straight upon reject you. If you just go and say, I'm interested in research, no one will believe. So if you want them to believe that you are interested in research, then you have to show something that you have done your homework. So when you show them that, then they will further guide you. And that's how you will start your process of research. Along with that, you have to also start getting a good hold of basic of research fundamentals. Like how to do, like what is review of literature, then what is the methodology, what types of studies are there, what types of research are there. So all that. So that will be covered in the further slides, and we will be also having separate sessions on each one of them later on in this series. Now, a tip that I would like to give, because most people struggle at this, including myself, that if you don't have any idea for, let's say that you are a first year student or a second year student, and you don't know whom to contact in the respective department, because as we all know that many times professors, so people are not that friendly and we are a bit hesitant. या फिर डर लगता है. So what you can do is basically gather intel that in your college, which seniors have done research before, then you should contact them and ask them which professors can help you. और अगर आप के इसमें ऐसा कोई नहीं है तो आप एक काम और कर सकते हो. Let's say if you're in first year, so if you have good professional relations with any professor, so you can ask them कि फॉर एग्जाम्पल एनाटॉमी के प्रोफेसर को आप पूछ सकते हो कि सर मैम कि ये सब्जेक्ट है, लेट्स से कि पैथोलॉजी में कोई रिसर्च करना है, तो ये सब्जेक्ट है, मैंने इसके ऊपर पढ़ा है ये टॉपिक पे, then I want to conduct research in this, but I don't know anyone in the pathology. So you can simply ask your anatomy professor to tell whether if there's someone I can contact. So they will definitely help you out. So next thing is how to start. Then after that, when is the best time to start? Okay. So the thing is, many people think that where like in the first year itself, how can we do research? Or we are in the third year, so can we do research? Many people ask me that. So actually, when can you do research? So the thing is, there is no like set criteria that you should do research in first year, second year, third year, or third minor year or third major year. But the only thing is, for like example, for certain grants, उसके लिए एक एलिजिबिलिटी क्राइटेरिया होता है. जैसे फॉर एग्जांपल ICMR STS की अगर बात करें तो पहले वो फर्स्ट ईयर टू फोर्थ ईयर तक ओपन, फिर उन्होंने फर्स्ट ईयर से थर्ड ईयर तक कर दी. नाउ इट इज ओनली फॉर फर्स्ट ईयर एंड सेकंड ईयर स्टूडेंट. अपार्ट फ्रॉम दैट, इफ यू आर डूइंग एनी इंडिविजुअल रिसर्च या फिर if you are applying for any other grants for that respective subject, say for example IPHA has their grant for PSM department, then TBAI have their grant for the TBC, tuberculosis, then pediatrics IAP, they have their grant for pediatric subject. So if you want to apply for them, you can surely apply. Okay. So we will have a brief overview कि कौन सी year में क्या-क्या pros है और क्या-क्या cons है. So in the first year, तो first year में ऐसा है कि basically first year is a very good time to start. The only problem is कि पता नहीं होता है. Okay. So even I myself, I wanted to apply for the ICMR STS in the first year itself, but I could not get to any senior or any professor in the first year, so I did not know what to do further. I had interest, but I could not proceed ahead. So in the first year, if you have the right guidance, and along with that, you also have to have a basic knowledge of the first year subjects, let's say anatomy, physiology, biochemistry. So because that sets the your foundation. So if you have the board, so first year maybe research करना pretty much feasible है. Second year मेरे हिसाब से is a very convenient time, because the thing is कि you have cleared your first year, so you have a like basic fundamental grasp of all the three subjects. Then along with that, time also is there, because ahead in the third year, minor and major both, जो भी academic load है वो धीरे धीरे बढ़ते जाता है. तो उसके साथ फिर उसके वजह से सेकंड ईयर जो है, सेकंड ईयर का जो फेज होता है, दैट इज more convenient. And also you are well quite settled in your college life. Also you have made contacts with your let's say seniors, your professors, and you're bit familiar with all of them, because first year में ऐसा काफी कुछ पता नहीं होता. Okay, so next is now the main process. What is the workflow of research, कि कैसे होती है. So basically research में ऐसा है कि first you have to figure out कि what is the main problem you want to address. So that is called the statement, research statement. Then when you make a question out of it, then it becomes a research problem. So after you have selected or you have found that research problem, so उसके बाद में you have to do a review of literature, कि उसके ऊपर जितना भी literature available है using various platforms such as PubMed or Google Scholar, you have to do a review of literature. Then उसके बाद में then you develop a hypothesis. मैं अभी बस I am like just telling you the order. We will one by one come to all of these topics. So then we do formulation of hypothesis. Okay. Then from that hypothesis we make the research design, which includes ki like study kaha hongi, what population you will involve, then what will be the sample size and everything. So after that, then you go for the data collection. You start the actual data collection. Once you have collected this data, then you feed it into you process that data and you feed it to the computer for analysis. Then after the analysis has been done, so the results are created. So results are interpreted to test where the hypothesis is true or not. And then from that, this whole information, we prepare a final report and then it is presented. So this was a brief overview. Now we'll head one by one. Okay. So the first thing, the research problem statement. Okay. So I will give example से समझना थोड़ा आसान हो जाएगा इसको. So research statement क्या होता है? तो research statement is nothing but कि जो कुछ भी प्रॉब्लम है उसको एक डिस्क्रिप्टिव और फैक्चुअल वे में बताया होता है. It is actually a declaration that describes the what we can say the current state of affairs and why it is a problem. ठीक है. So for example, जैसे इसका example मैं अगर दूँ, so a simple example would be like despite the availability of free iron supplements, the prevalence of anemia amongst adolescent girls in rural Maharashtra remains at 65%, which is significantly higher than the national average. Now let's say this is the problem statement. Okay. So from this problem statement, then we have to create the research question. So the research question for the same would be कि this ये तो हमारी प्रॉब्लम होगी कि आयरन सप्लीमेंट देने के बावजूद that we are giving iron supplements, the iron supplement, still the level of anemia among adolescent girls in rural Maharashtra is higher than the national average. Okay. So from this research problem, we will then create a research question. What are the primary socio-economic barriers preventing adolescent girls in rural Maharashtra from adhering to the आयन सप्लीमेंटेशन, ये हमारा हो गया रिसर्च क्वेश्चन. सो अभी रिसर्च क्वेश्चन कभी भी बनाते से वी हैव टू टेक इनटू कंसिडरेशन सम पॉइंट्स. आई विल टेल दिस इन लाइक हमारी जो आने वाली लेक्चर सीरीज है, इसमें हम ट्राई टू, ये थोड़ा डीप में बता जाएंगे, बट जस्ट टू गिव यू एन ओवरव्यू कि वी ट्राई टू अप्लाई अ फाइनल क्राइटेरिया whenever we develop any research question. So that criteria is generally called final. So whatever research question you are developing, it should be like feasible. Okay, तो जो भी आप स्टडी डिजाइन करोगे उस रिसर्च क्वेश्चन पे बेस्ड, वो फिजिबल होनी चाहिए जस्ट सेटिंग में आप कर रहे हो. For example, if you are conducting at your hospital or if you are conducting in the community around you, so it should be feasible. Then it should be also, it should be feasible. Then it should be novel. It should be something new. Then the next thing is it should also be ethical. कि कोई भी research करने से पहले you have to get a ethical clearance. So if you get the ethical clearance, then only you can pursue the further research. And the R stands for that it should be also relevant. ऐसा नहीं कि you can just go and do research on anything. Okay, so it should be relevant to the current problems prevalent in the society. Okay. So इसमें भी वही stated है on the slides as you can see कि whichever research problem you take, so it should be very precise, clear, and it should be addressing a very specific topic. It should include the essential points of the study. जैसे फॉर एग्जाम्पल पहले वाला जो हमने एग्जाम्पल लिया था कि डिस्पाइट द अवेलेबिलिटी ऑफ फ्री आयरन सप्लीमेंट्स, उसमें प्रिवेलेंस ऑफ अनीमिया अमॉन्ग्स एडोलेसेंट गर्ल्स जो है वो रूरल महाराष्ट्र में नेशनल एवरेज से ज्यादा. ओके, सो इसमें दी study population is also mentioned, the study setting is also mentioned, and what we want to measure it, that is the anemia ka prevalence, that is also mentioned. So it should be clear, systematic, and precise, containing all the points of the study, and it also found the foundation of the research proposal. अब इसी जो problem है, problem से हमने research question बनाया. research question बनाने के बाद में अब मुझे ये देखना है कि primary socio-economic barriers क्या है. So now to evaluate, like, to find out what are the primary socio-economic barriers, then I will design the study like that. So it is all based upon how you take your research problem. If your research problem has been taken in a proper way, then only you will be able to properly design your study. So the next thing is relevance. So whenever you take a study, you have to see whether it is relevant at your local level or it is relevant at your national level. Then the second thing is कि you also have to justify why the research is necessary. अभी जैसे anemia is a very crucial problem. Like most of the like in more than 65% of the adolescents girls में मिल रहा है. So it is इस problem को आपको address करना है, इसलिए ये research necessary. Okay. So we have already discussed the priority point. And you have to also state how results will be utilized. So ये तो खैर बाद में वाले इसमें पॉइंट आएंगे तो अपन इसको डिस्कस कर लेंगे लेटर ऑन. ओके, देन फील्ड ऑफ एप्लीकेशन. हाँ, तो कि whatever output from the research will be generated, whatever there will be confidence from the research, उनकी यूटिलिटी होनी चाहिए. जैसे फॉर एग्जाम्पल they can be useful for making new policies, new guidelines, or any new methods for management of any disease, or to any kind of like any healthcare में अगर वो किसी भी टाइप से हेल्प कर रहे हैं. फॉर एग्जाम्पल इफ यू डिवाइस a screening test which is better than the other, so it is also then yes. So target, next is target audience. So you also have to define the target audience की study किस पे होना. Okay, so the next thing in our next step is review of literature. हमारा जो research problem था वो हमने जो है वो सेट कर लिया है. अब उसके बाद में हमको उसको review of literature करना. So review of, what is review of literature? So review of literature is basically, in simple terms, you have to just analyze whatever we already know about that topic. Okay, and you have to find gaps in it. So whatever gaps are present in there, then you will try to fill up those gaps. Okay, so this is also what we did. So ये पहले भी करते हैं. So like it is done at two phases. First, whenever you want to like select a topic, you do a review of literature, then you find gaps, then you make research statement on that topic. Then again, you do a more thorough review of literature. So it helps you refine your problem statement. Okay, so that makes your problem statement a bit more clearer and precise. Okay, so what is the goal? It is to familiarize with the existing knowledge on the research problem. Then it also helps you check if any similar problems have already been investigated. So let's say, pehli agar recently, if the same study has been conducted in the same community, then doing that same study will not help that much if all the parameters are same. You have to do something novel each time. Okay. Okay, so outcome, yes, it depends on understanding of the core problem, which again helps us refine the research statement. Then आप मुझे पूछोगे कि review of literature करते कैसे? So basically, we use platforms like PubMed, Cochrane, Google Scholar. If you go on Google Scholar or on PubMed, you have whichever topic you want to do review of literature, you have to just simply type the heading of the topic, and you will get all the papers or articles related to that topic. How to how to properly do review of literature. This will be also covered in depth in upcoming series. ये खुद में एक बहुत बड़ा टॉपिक है और इस पे like proper workshops होते हैं 2-2 दिन के. So what are the uses? As we have seen, it helps define the statement of research problem. Then उसमें it also helps us identify the study variables कि हमें किन दो variables को study करना है और किस पे data collect करना है whenever we are conducting our study. Then that helps us formulate our hypothesis. What is hypothesis? We will see. Okay. So next is formulation of research hypothesis. So what is hypothesis? So hypothesis is basically एक what we can say in simple terms एक theory है which can be true, which cannot be true, and that we want to test, but it is actually based on whatever reading we have done on the topic. So whatever facts are there, we have read those, and then uske upar se we have made one logic which is based on logical reasoning. We have made one assumption, we can say, and now we are gonna test it. So the main thing is the whatever hypothesis you make, that the theory you predict, it should be it can be testifiable, and it also can be falsifiable. And the main thing is third aspect is it should be like reciprocable. Like पहले चीज तो टेस्ट करता आना चाहिए. ओके, देन उसको सेम स्टडी को कहीं और in different setting it also should be able to verify. Okay, for example, if you give an example कि God exists, now if you form hypothesis like this, you can neither prove it nor disprove it. So ऐसा कुछ नहीं करना. You have to take a very clear hypothesis which can be tested. Okay, and you should be able to either prove the correlation between two variables or disprove them. Okay. So next is working hypothesis. So basically hypothesis में क्या होता है कि there is one thing is called research hypothesis, then one thing is called working hypothesis and null hypothesis. So for example मैं example देके बताता हूँ कि what can be a research hypothesis. So a research hypothesis can be something like does active participation in at least one undergraduate for example कि मान लो कि जो undergraduate students है, so if they participate in research activities, it correlates with higher academic grades. Okay, this can be one research hypothesis. Does active participation in undergraduate research projects correlate with higher academic grades? Now how will you test it? So हमें एक ऐसा क्वेश्चन चाहिए कि जिसको हम ऑब्जेक्टिव वे में देख सके, तो जिससे हमें ऑब्जेक्टिव बनाने में हेल्प हो। तो इसको हम कैसे फॉर्म करेंगे कि students who participate in at least one research project during their undergraduate program will have a significantly higher mean scores than students who do not participate in any research. Okay. Now, what is null hypothesis? Null hypothesis is exactly ulta. Okay. So, what is null hypothesis? Null hypothesis is there is no significant difference in the mean scores between the students who participate in research activities and who do not. Okay. So, it is like that. So, what is the role of the working hypothesis? So, it is to direct us in a very specific way. Okay. उसका फंक्शन ही है कि इट हेल्प्स कीप द इन्वेस्टिगेटर ऑन ट्रैक। ऐसा नहीं कि हम कुछ लाइक वी हैड सम ऑब्जेक्टिव्स और वी वांट टू फाइंड दैट बट हम भटक गए। सो दैट्स व्हाई वर्किंग हाइपोथेसिस बनाया जाता है कि वो बहुत ज्यादा ऑब्जेक्टिफाई कर देता है। इट मेक्स द रिसर्च क्वेश्चन इनटू समथिंग व्हिच कैन बी मेजरेबल। ओके, so then how to develop a hypothesis? Now this is a very crucial question and it is a very important part. Hypothesis actually इसके लिए when you read literature on that particular topic and when you read similar studies that are related to your study, तो उनके जब आप सिमिलरिटी देखते हो तो उससे देन आपको एक अंदाजा लग जाता है कि हाँ, in this way a research hypothesis can be made. Okay, and in the starting, in the beginning, it is quite hard. So what you can do is you should consult your mentor and faculty for that, and they will definitely help you with it. Okay, so the next thing is the research design. Okay, तो अब research design क्या होता है? So अभी तक हमने introduction देख लिया है, ठीक है? ये what was the problem and everything. Now we want to conduct a study. So how will we conduct the study? So ये जो सब होता है, it is all mentioned in the research design. Okay. So in the research design, you have to select what research strategy you will use. Okay. So now I will not be going into the depth, but there are multiple research strategies. Some of you might have heard about them. Like there are cross-sectional studies, then there are longitudinal studies. There are what we call observational studies, simple, or interventional studies. Observational studies mean we just observe, like in case of surveys. Okay. Interventional studies means what, like there is a group A, there is a group B. Group A को placebo दिया, group B is given certain drug. तो ये intervention हो गया. Then we record the output. तो ये क्या हो गई? Research strategy होगी. Research strategy is completely based, means which research strategy you will use is entirely dependent upon what are the objectives of your study, and objectives are dependent upon what is the hypothesis of your study. Okay. Then is the second thing, key research setting. So in which environment you will conduct your study. For example, let's say you can conduct your study, it can be community based or it can be hospital based. Okay. Then the next thing is determination of sample design and sample size. So in determination of sample size, okay, so there are, like, according to different studies, there are different formulas. There is, and if like either you have to read all that stuff, or what you can do is in every college there is a PSM department. PSM department में biostatistician होते हैं. तो आपको उनके पास जाना है. You have to give them the like ऐसा study करना है. These are the previous studies and help me figure out the sample size for it. Okay. So odd station, there are certain things, then they put that into the formula और formula में से एक value निकल के आती है. So it is completely based upon कि इसके पहले जो studies हुए उनमें कितनी sample size यूज की थी और उनके results क्या थे, उस हिसाब से फिर sample size decide होता है. Okay. Then sample design में क्या चीजें आती है? A sample design is basically who you would include in the study and who you would exclude in the study. Okay. Then controls. Obviously, if it is a study in which controls, why do we use controls? Controls are used to see to compare कि हमें इफेक्ट देखना है, so we need a reference. So for that we use a control कि इनमें चेंजेस हुए और इनमें चेंजेस नहीं हुए, so that to cancel out any errors also. Okay, so the next thing is study instrument कि आप जो आपकी जो study कर रहे हो, so for that which methods or instrument you will be using. Okay, then the next is key plans for collection of data. In what form you would be collecting your data for, let's say, for example, if it is a qualitative study, okay, जिसमें it is more like in qualitative studies we conduct interviews and everything. Okay, so for that you have to record those interviews. Okay, so that in that you would be recording the interview. If it is a quantitative study, you would be giving them, for example, let's say survey है. Okay, so usme you would be just giving them, either you can ask them to fill Google forms, or you can just hand out them the questionnaires you have made. Then they will fill those questionnaires, and then you will collect that data. Okay, moving on to the next, that is the execution of the code. Okay, so the next part is the analysis of data. अभी हमने ये सब डिसाइड कर लिया कि कैसे क्या करना है, कलेक्शन क्या करना है. Okay, we are done with the research design, we are done with the research setting, कौन से पॉपुलेशन में करना है, किस वे से करना है, डाटा कैसे कलेक्ट करने वाला है, ये सब डिसाइड करने के बाद में वी गो एंड कलेक्ट द डाटा. नाउ वंस वी हैव कलेक्टेड दैट डाटा, देन अभी we want to compare that data and use it for statistical analysis so that we can derive conclusions from it. Okay, so for that purpose we feed that data into the computer. Okay, and then the data is classified and tabulated. Okay, so those variables ऐसा नहीं कि मतलब सब कुछ डाटा उसमें डाल देते हैं, only that data which we think might be related to that. For example, if you are conducting any study, for example, let's say you are conducting a study on diabetes. Okay, diabetes में ऐसा है कि if your study is limited for that particular community, तो उसमें एड्रेस वाले पार्ट का कोई उसमें रोल नहीं. So जब भी आप कोई डाटा फीड करते हो तो उसको आपको क्लासिफाई करना होता है, कोड करना होता है, ताकि फिर उसको स्टैटिस्टिकल टेस्ट लगा के हम एनालाइज कर पाए. ओके, तो देन आफ्टर दैट वी टेस्ट द हाइपोथेसिस. क्या हमारा हाइपोथेसिस था, लेट्स से हमारा पहले वाला हाइपोथेसिस लेते हैं कि दो स्टूडेंट्स who have higher, like who participate in research activities have higher mean score than other students. Okay, so हमने सारे स्टूडेंट्स जो थे उनके we collected their name, then we collected their roll numbers, then we collected their age. Now age में इसका हमारा कोई use नहीं है, but okay, then we collected their marks and everything. Okay, so now what we will do is we will have one column कि कितने रिसर्च एक्टिविटीज में उन्होंने पार्टिसिपेट किया. देन वी विल हैव अनदर कॉलम कि उनके स्कोर कितने थे. नाउ देन we will correlate this using statistical test. Okay, तो इसको statistical test यूज करके हम उसमें से रिजल्ट्स निकालते हैं कि इसमें कितना कोरिलेशन है. फिर वो जो आउटकम आता है, okay, then that is used for either accepting the hypothesis or rejecting the hypothesis. Okay, so next point is interpretation and generalization of the results. Okay, तो अब हमारे पास रिजल्ट्स आ गए हैं. Okay, रिजल्ट्स क्या होते हैं, रिजल्ट्स आर नथिंग बट की whatever observations we had. Let's say कि for example 66% of the people who were involved in research activities have higher mean score, like have more score than the other students who did not participate in any research activities. तो अभी ये क्या हो गया, ये हो गया एक ऑब्जर्वेशन. नाउ इस ऑब्जर्वेशन पे से यू कैन कंक्लूड that those who participate in research activities have a higher mean score. Okay, so now what is, ये हो गया interpretation. Okay, अब generalization. What is generalization? तो generalization ऐसा होता है कि कोई भी hypothesis अगर बार बार टेस्ट करने के बाद में through various study designs you repeat the same study in same way or डिफरेंट है. मान लो कि कभी केस कंट्रोल स्टडी किया, उसके बाद में यू डू अ कोहॉर्ट स्टडी, यू डू. तो अलग अलग टाइप की स्टडीज यू कंडक्ट at the same setting or a different setting and you are getting the same results. Okay, then it is called generalization. Okay, तो उसके हिसाब से फिर then it allows us to build a theory कि हाँ ये it has been confirmed many times, now we can build a theory upon it. Okay, and then we will move on to the last part, that is the preparation and presentation of the study results. Okay, so अभी we have conducted the whole study. Okay, अब हमारे पास डाटा है, everything, we have done the testing of the hypothesis and everything. अब हमारे पास सब available है. Okay, so now we are on to the last phase of research. Okay, that is the preparation of study results. Okay, so this is also one of the most important thing in your research. तो इसमें we use the structure, तो बोलते हैं इमरेट स्ट्रक्चर. ओके, तो इसमें यू राइट द, जैसे आप कोई भी रिसर्च पेपर देखते हो तो जस्ट यू आर राइटिंग, नाउ यू हैव डन एवरीथिंग, नाउ यू आर जस्ट गोना राइट इट. ओके, so the IMRAT structure is used. Okay, so what is IMRAT? It is basically introduction, then methodology, then results, and then discussion. So introduction में what we do is we start by a broader context. Okay, so for example, let's say I am conducting a study on diabetes. Okay, so what I will do when I am writing the introduction part, so I will write in that key how diabetes affects the entire population. Okay, impact of diabetes on everyone. Okay, then I will come to India. If I'm conducting study in my college, then I will show the like India में इतने इतने लोग diabetes, India is the diabetes capital. Okay, then I will mention कि हाँ कि that I want to do a comparative study in the rural population and the urban population कि उन्हें क्या जो सर्विसेज प्रोवाइड की जा रही है डायबिटीज में उसमें क्या डिफरेंसेस है. तो यू हैव टू यूज अ फनल अप्रोच. यू स्टार्ट फ्रॉम द ब्रॉडर कॉन्टेक्स्ट की डायबिटीज से इतने ये सब इम्पैक्ट होता है, these many people suffer from each year. So from that we have to narrow down, and after narrowing down, when you have come to your main point, okay, after that you have to also explain in short if this study is done, whatever output will be there from this study, how will it help in helping the community, how can it be used. Okay, this was the introduction part. Introduction part छोटा था. Okay, then comes the methodology part, which is quite the big one. पूरे पेपर में ये बड़ा होता है. मेथोडोलॉजी में अभी हमने जो पूरा किया था कि हमने रिसर्च डिजाइन सिलेक्ट किया, देन रिसर्च सेटिंग सिलेक्ट किया, देन हमने बताया इंक्लूजन क्राइटेरिया की कौन से पॉपुलेशन में हम करने वाले हैं, देन हमने डिसाइड किया कि एक्सक्लूजन क्राइटेरिया कि किसको हम नहीं लेंगे. ओके, देन सैंपल साइज हमने कैसे निकाली, देन अगेन आफ्टर दैट then with statistical tests we used, how data was analyzed, then you also have to mention your ethical clearance. So it is basically methodology is how you did your research. Okay, then the third part is the result section. In result section, whatever data you obtain during the your observation, during when you are performing your study, all that data has to be reported in its raw form. Remember one thing, do not do the mistake of making any bias. ऐसा नहीं कि you want to prove a point, so you will manipulate data so that it will lead to the said thing. Okay, to help you prove your point. ऐसा नहीं होता. If it is not in your favor, let it be. It does not decrease your quality of work. Okay. So in results, we report raw data, और फिर वो data का क्या है? If you just write everything, it won't be meaningful. So what we do is we try to like depict the important variables in the tabular format. So via like tables और pie chart, जो भी information है हम उसको graphically present करते हैं. ठीक है. अभी ये information present करने के बाद, let's say कि हमने वो जो हमारा जो table था कि कितने students थे जो रिसर्च में पार्टिसिपेट कर रहे थे, एंड देन दे वर हैविंग गुड ग्रेड, grades than other students who were not participating in the research. Okay. So वो हमने table वहाँ पे बना दिया. Along with that, we made a pie chart relating to that only. Now comes the discussion part. Now in the discussion part, इसके पहले जो इस पे similar studies हुई थी, उनका basis लेके we try to connect our study with that. In this study, this was also found, and I find the same way. Or in studies till date, ऐसी finding मिली थी. But now I have found a slight deviation. Now अभी कितना deviation मिल रहा है या कितनी similarities मिल रही, so you have to state that in the result section, and you also have to state the limitations of your research. Okay, so for example, let's say आपने जो study की, so it was just limited to your college. Okay, so this is one limitation, or the another limitation could be you were not able to get the data from the whole class. This is another limitation. So why it is important to mention the limitations in your research paper is because it is the limitations give the scope for new research that can be performed in the future. आपके बाद में कोई इंसान आएगा, that person will try to address those limitations. Okay, and that's how the process of research continues. If one person does the study, there are some limitations. Then another person comes and addresses those limitations also. Then उसकी study में भी कुछ एक दो limitations होंगे. So in this way, the whole process gets refined, and we try to get to know or get near the what we can say is absolute truth. हम कभी भी like we cannot say statistically that what we know is the absolutely the correct thing, but ये process के through we get nearer and nearer to it. Okay, so this is the whole way how a research paper is written. इसके साथ में कुछ और points होते हैं, like for example if there are any conflict of interest or whatever questionnaires and everything you have used in your, you have to attach in your research paper. Okay. Now the another last part is the presentation and publication of your study results. Okay. So in scientific community, it is said that unpublished work is considered never done. Even if you are Newton or if you are anyone, let's say you discover a cure for some cancer which is incurable, but if you don't present it, it's of no use. Okay, so this is a very important aspect, because whatever findings you have to disseminate to the community, to the scientific community, so that it can be added to the literature. Okay, so after completing your research, you should do two things. Whenever you get an opportunity, you should apply for any conferences that are happening, and you should go and you should present your study there. Okay, इसके क्या benefits है? पहले तो when you will present your study at a conference, you will gain confidence. Second thing is that वहाँ पे आप जब present कर रहे हो, so after presenting your study, the judges, the panel will question you. So that will help you realize the gaps in your research. Whatever constructive criticism they are giving you will help you in future for further increasing the efficiency of how you do your research. So it is basically to help you be better. Okay. So and another thing is कि आप जब ऐसे conferences में जाते हो, like what I know today is most of because of my networking. तो आपका network build होता है. There are more people who are inclined towards research. You get to know their perspective also, and sometimes you are just amazed. Okay, it helps broaden your horizons and how you think. It is because in research everything is about thinking and then executing it. Okay. Okay, so this was about presenting your research. Along with that, you also should publish it in a journal, because once you publish it in a journal, then only it will be added to the scientific literature. So this is the whole journey of doing research from start to the end. Now this was only meant to be a brief overview. Each of this topic we will discuss in the further upcoming series. Okay. Now, did anyone raise hand? Yeah. Wait. Just 2 more slides. Now, another question is like how to manage research along with academics. Okay. So for that, I would recommend is like you have to do proper planning. Okay. Research is a long thing. First thing you should remember is research is a marathon, not a sprint. So you have to do proper planning throughout the whole year. When is there less academic load on you? Okay, and you have to also and then according to that you have to plan phases of your research. In this part I will do the review of literature, then in this part I will do my data collection, and then in this part I will do data analysis, and then will prepare my final report. Okay, this was the planning part. Then after that, what you can also do is daily goal setting. For example, let's say you have to collect 100 samples. Okay, your sample size is 100. Okay, so you can set a daily limit of like every day I have to get 5 samples. Okay, so when you do that and you plan it systematically, it doesn't become load. Okay, now what to do at the exam time? So when you plan like it won't be a burden at the time of exam. And during the time of exams, I will advise that you should 100% focus on your academics and put the research on a warm food. Okay. Now the fourth thing is delegate and collaborate. So what you can also do is, if you are not applying for any grant, what you can do is you can find others interested in research in your college peers, or even from another colleges who are interested. Then you can form a group and then you can conduct that study together. Okay. Or even if you are applying for a grant, what you can do is many people are really eager to know more about the research process to get hands-on experience. So if you want any help in data collection part, you can ask if anyone wants to volunteer for that. Okay. So this is how you can manage it with academics. It just needs a bit of organization and systematic planning. So coming along, like what are the problems? So mainly the challenges we face in the research journey is the very first challenge is about the lack of right guidance and information. Like जिस मेरे जर्नी में था कि फर्स्ट ईयर में पता ही नहीं था, बस इतना पता था कि STS कुछ तो होता है through which we can conduct our further research, but there was no one to tell कि कहाँ से अप्लाई करें या फिर कैसे further proceed करें. Okay. Then apart from that, the second problem is many people face is like grants पता नहीं होती है. Like we want to do research, but we don't know research grants that are available for UG students. Then another problem is कि हमने research तो कर लिया, but now we want to present them at conferences, research conferences, but we don't know where they happen and we don't get notified. Okay. Then fourth thing is what resources can we use to learn fundamentals of research? Along with that, like how to learn skills like doing review of literature or how to use Zotero, then how to use SPSS. Okay. So these are all Zotero and SPSS इनको डरना मत. These are just softwares that help. Zotero is used for referencing and citation. SPSS is used for data analysis. Okay. तो ये कुछ प्रॉब्लम्स है जो हम फेस करते हैं. तो सीनियर वाला जो पार्ट है या फिर आपको कोई नहीं, so what you can do is LinkedIn is a platform where you can find people interested in research or who have done research. You can reach out to them and then they will surely guide you. Okay. Then the second thing is grants के बारे में पता नहीं. Okay. So इसके लिए one thing that you can do is you can go to your PSM department and ask, because mostly research का जो कुछ भी होता है PSM department में ही आता है, वहाँ से ही disseminate होता है overall, या फिर आपके जो particular department उसमें भी notices आती है, बस वो sometimes they don't reach to us and everything. Okay. Then research conferences में कैसे जाए? तो again I will say you have to increase your networking via LinkedIn. आप एक बार एक कॉन्फ्रेंस में जाओगे, वहाँ पे you will meet with another other people, you will network with them, and then you will get into that pool, and then वो फिर आप एक बार वो सर्कल में घुस गए कि फिर वो आपके पास ऑटोमेटिक आते जाएगा. ओके. देन नेक्स्ट थिंग इज कि रिसोर्सेज. हाँ, तो रिसोर्सेज के जो लिस्ट है, ओके, तो रिसोर्सेज की लिस्ट जो ग्रुप है सलाह शॉट्स वाला व्हाट्सएप ग्रुप जो है उसमें हम डाल देंगे. ओके. उसकी जो भी लिस्ट है, बुक्स एंड एवरीथिंग. ओके. तो वो लिस्ट में आई विल ट्राई आफ्टर द सेशन आई विल पुट देयर. Although I will suggest that कि research एक ऐसी चीज है, it's like swimming. You can definitely read a book, but it's quite tough to understand, and you don't understand it very well until you do it yourself. Swimming पढ़ तो लिया कि हाँ ऐसे ऐसे करना है, but जब तक आप पानी में उतरते नहीं हो, until and unless you enter the water and do it yourself, you cannot learn it. Okay. And then the last part, the review of literature, Zotero, spaces, how to have a command over these softwares or how to use them. इनके लिए we will plan for the sessions, or you can also find sessions for them on other platforms also, like QMade and everything. Okay. And also for this, so अगर इसके बावजूद भी if you are still facing this problem, so what we are trying to do is we are gonna be like making a community on Salaah Shot also, like those who want to join can join. So Salaah Shot पे एक research community बनाने का हम सोच रहे हैं if people are interested. So इसमें जो भी है कि रिसर्च से रिलेटेड जो भी इवेंट्स होते हैं, रिसर्च ग्रांट्स होती है, उनकी जो अपडेट्स होते हैं इस पे डाले जाएंगे. देन व्हेनेवर की कोई भी अगर रिसर्च रिलेटेड कॉन्फ्रेंसेस हो रहे हैं या वर्कशॉप्स हो रहे हैं, जैसे मैंने ICMR के वर्कशॉप्स की या अदर वर्कशॉप्स हो रहे हैं, तो उनके जो भी रिलेटेड जो इन्फो है, ब्रोशर है, वो यहाँ पे शेयर कर दिए जाएंगे. उसके बाद में अगर कोई रिसर्च प्रोजेक्ट अगर कोई ग्रुप में से कोई कर रहा है, उनको अगर हेल्प चाहिए, तो दिस कैन बी also be a platform to collaborate, so you will also get research opportunities. And ये जो भी वर्कशॉप बेसिकली होते हैं ना कि रिसर्च के, जैसे फॉर एग्जांपल आई अटेंडेड CCMB मेडसर्ट प्रोग्राम, सो इट वाज अ 15 days प्रोग्राम जिसमें पूरी रिसर्च की ड्राई लैब्स, वेट लैब्स दोनों की ट्रेनिंग दी गई हमें वहाँ पे. सो एनी रिसर्च प्रोग्राम whether it is conducted by CCMB or whether it is conducted by ICMR, they generally ask for CV, and CV से भी main important thing is they ask for SOP or proposal. So we will also try to help you out in figuring how to write SOP or how to write a research proposal for that. Okay. So the next thing I would like to discuss is the main thing, many this question might be in head of many of you कि ICMR STS के बारे में क्या. So ICMR STS के लिए हम जल्दी से सेमिनार लेने वाले हैं. तो वो जो सेमिनार रहेगा तो उसमें ICMR STS के लिए एवरीथिंग विल बी कवर्ड कि एलिजिबिलिटी क्या है, टाइमलाइन क्या है, कौन से टॉपिक्स, विच टॉपिक्स आर सिलेक्टेड, okay, what should we keep in mind while writing the proposal, how to draft proposal, how to apply, and what are the benefits. Everything will be covered in that particular session. Okay. So thank you for listening to me patiently.
Okay. Thank you, Shravan. It was really insightful that you shared from how to begin and till the end how to do it. Now we can move to the Q&A session. If you have doubt, you can share in the chat box. Meanwhile, Ganabashya, you have raised your hand if I am spelling it right. Do you want to unmute and ask your question?
Yes, definitely. Am I audible?
Yes, you're audible. You can ask.
My question was for the research paper or research article. Whenever we want to publish any article or research paper from our institute, Is it necessary to take ethical clearance, which I have heard from the respective medical college or any medical college within 25 or 30 kilometers of your like location?
Okay, so regarding that, so ethical clearance का ऐसा है कि you have to take it before collecting data only. If you don't have ethical clearance, publication तो बहुत बाद में आता है. So if you want to start the research, so research data collection के पहले ही आपको जो है, you will need to get the ethical clearance. Okay, it can be if so वहाँ पे जो भी नियरेस्ट जो भी वहाँ पे जो भी मेडिकल बॉडी है, सो वहाँ पे डेजिग्नेटेड होते हैं, सो उसके हिसाब से आपको वहाँ से एथिकल क्लियरेंस लेना होता है. इफ यू आर कंडक्टिंग इन योर विसिनिटी, यू शुड टेक इट फ्रॉम योर मेडिकल कॉलेज. हर कॉलेज की अपनी एक इंडिपेंडेंट इंस्टीट्यूशनल एथिक्स कमेटी होती है. So when you have to like write one proposal, just the way you write for the ICMR, STS, then you have to present that proposal to the IC committee. Then they will review that. Then they even ask you to present it to them. Then they might ask some question, and after that, after reviewing all that, they will give you the ethical clearance. Once that is obtained, you can conduct your study, and then the same one you need to upload or share when you are publishing.
Okay, thank you.
Okay, so any next question? Anybody want to ask question, or we can take silence as a no, and we can wrap up the session then. Anybody want to ask question?
Are there any questions in the chat?
Yes, sir, there is no any question in the chat. Okay, Sean. So before wrapping up, any final advice from your side or any tip for the research?
I would just like to say one thing, like the most grave mistake that we do is that we underestimate ourselves quite a lot of times. So we should not do that. We should believe in ourselves, and we just keep working towards our goal until it is achieved. That I would like to say.
Okay, next we have Manisha Kundu. You have raised hand, I guess. I think she has dropped her question in the chat box. You can see it.
Yeah, Google Form will be easier to collect data. Okay, so yes, Google Form is easier to collect data also, or then analysis is also quite easy. But the thing is, many times usme, if you are conducting a basic survey, then it's not an issue. But बहुत से बार ऐसा होता है कि like people don't fill it properly, like they just ran like ठीक से भरते नहीं, तो उसके वजह से कुछ एरर आ सकता है. तो उसके अलावा it's an excellent way to collect data. Google Form is, yes, obviously it is easy also, and it can be used on a wide scale also. For example, if you are conducting a study on mental health of medical students in your state, okay, so you can just create the Google Form and you can circulate it within the groups of all the medical colleges and ask the students to fill it. And data will, if I take it on my own from direct patients, yeah, it is better.
Okay, any more questions from your side? Guys, if you do have any question, please post within 1 minute, or we will take silence of none, wrap up this session. By the way, Shravan, how's your study going on?
Yeah, it is going great.
So when will be you having your exams?
My exams will be there in August, from 1st of August.
Okay, final the university one.
What?
The university exam.
Yes.
Okay. So I think we don't have any more questions, so we can wrap up this session now.
Thank you for having me.
Okay, thank you, Shravan. It was really great insights that you shared. Thank you. Thank you everyone for the
हेलो
joining.
सर, एक क्वेश्चन था
Yes.
सर।
Yes.
मेरा आईसीएमआर का स्टेज प्रपोजल पिछले साल सिलेक्ट हुआ था,
Okay.
तो जो गाइडलाइन था उसमें दिखा रहा है, मतलब मेरा जब सिलेक्ट हुआ था तब मैं फर्स्ट प्रॉप में था, अभी मैं सेकंड प्रॉप स्टूडेंट हूँ।
Okay.
तो जब वो जो गाइडलाइन आया था, मतलब वो जो रिपोर्ट मतलब रूटीन आया था, तो उसमें था कि नवंबर में इंटरिम रिपोर्ट सबमिट करना है इस साल 26 में, तो वो कैसे करना है?
ओके, तो इस वाले पार्ट में ये एक्चुअली अलग से हम डिस्कस करते हैं क्योंकि उसको टाइम लगेगा थोड़ा। ओके, सो आई विल ट्राई कि मैं अगला वाला जो आईसीएमआर वाला जो एसटीएस वाला सेशन रहेगा उसमें एक बार इसको भी एक बार इंक्लूड कर दूँ। ओके, तो इंटरिम रिपोर्ट में बेसिकली यू डोंट हैव टू लाइक पूरा नहीं बताना होता, इट्स जस्ट काइंड ऑफ प्रोग्रेस मॉनिटर काइंड ऑफ थिंग। तो अभी तक तुमने क्या क्या प्रोग्रेस की है, बस दैट यू हैव टू सबमिट इट टू द आईसीएमआर को।
ओके सर, और इज देयर एनी चांस कि मतलब मेरा एक बार सिलेक्ट हुआ है पर अगले अगले जो जिसमें सिलेक्शन होना है उसमें भी सिलेक्ट नहीं हो सकता है, ऐसा कुछ चांसेस हैं?
Yes, agar if you fail to submit your interim report or final report on time, or along with that if your report उनको अगर लगता है ऐसा कि if you have fabricated any data या फिर if it is not written properly, so there is a chance that it may get rejected. So it is essential, उनके guidelines भी होते हैं, you have to write according to those.
इंटरिम रिपोर्ट पीपीटी फॉर्म में या पीडीएफ फॉर्म में जमा सबमिट करना पड़ता है?
Interim report का I am not sure about that. I will check once and tell you.
ओके सर, ओके, थैंक यू सर।
Yeah, wait.
Any more questions? Last time we are asking. Please ask if you have any question. Okay, thank you, Sean. We can wrap it up now. We don't have any more questions. Thank you for joining and guiding the students for the research.
Yeah, it was my pleasure.
Yeah.
चला गया।